Welcome, 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 everybody. Welcome to Care Concierge with Care Patrol, where education is the heart of everything we do. We're happy to have you here today, and we're happy to have our speaker, Karen Morse, an independent agent who will, I think, give us a great bit of detail about the insurance market today. I'm so excited about this topic, and as some of you may know who've been with us, it is a topic that was suggested by former attendees, as all of our topics tend to be. We are accredited by the State of Alabama Board of Nursing, and we're also accredited by the State of Alabama Board of Social Work. And both nursing and social work say that we can award 1.0 contact hour for today's content. And for social workers, this content is considered live or classroom and not a recorded hour, because we use an evaluation process that is password protected. And we give the password out at the end of today's discussion. And that way, the Board of Social Work maintains and believes, as do we, that you were here for the entirety of the session and you benefited from it. And I do hope these are beneficial to you. And again, I'm so excited when we can present a topic that's been asked for in our evaluation. We are a referral company, as we're sometimes known. I prefer to call Care Patrol Aging Care Navigators, because I think that's really more what we do. We advise people when they are in the midst of a crisis or simply in a planning mission, what the options are for care, soup to nuts, everything from home health to hospice to hospital to acute hospital stays, to Jerry site, to whatever it may be. We advise our clients as to how they will qualify for certain services, how those are paid. We'll assist them contact folks if we can, including lawyers and estate planners and independent insurance agents. So we like to be a source of as much knowledge and education as we can be for our clients, and we take that same approach to doing these CEUs, for which I'm most grateful you're here. Those of you who are with us on a somewhat regular basis know that I'm going to read for you, if you're participating by phone or driving or working or otherwise occupied. I'm going to read to you the evaluation link so that you can make note of it. And that link today is https://www.surveymonkey.com/r/ all uppercase letters KWYYQXX. That's our link. Remember, it is password protected. We give the password at the end. And today I want to let those of you know who've been joining us that normally your mics are muted, just because it can be somewhat hectic sometimes if someone unmutes by mistake. But today, each of you on this call or on this hour have the option to unmute yourselves and ask any questions you might wish to ask. And I would encourage you to do so, because again, this is a topic that's often mentioned by our attendees as one of interest. So I want you to get your questions answered today while you can with an expert, which is Karen Morse. And with that, I will give the floor to, thank you, Ms. Talbert. You're always so nice to repeat the link for folks. And welcome and hello to everyone who's spoken. And so folks are using the chat room. If you're new to Zoom, you don't know how to do it, move your cursor up to the top of your screen or down to the bottom of your screen. In one case or the other, a black bar will appear and the word chat is on it. Click that and you can join the conversation with us. And I want you to know, and I know Karen feels the same, that we're enriched by your questions and observations. by your experiences. We want to know what you think. We want to answer your questions. So please do discuss today. Someone is off on the mic. Maybe you intend to be, maybe you don't. If you don't intend, please be careful about being off mic. But Karen, as I said, I talk too much, and I'm going to give the floor to you now. Now that I've hogged it, but thank you so much for being here. We welcome you, and I look forward to hearing what you have to say.
You are so welcome, Sean. Thank you so much for having us today. As you can see, this is a Medicare 101 session. We can also at the end talk about ACA or health insurance on the individual marketplace, but this is a health markets presentation. I did not create it. I work for a field marketing organization, which we do sell Medicare plans, health insurance plans, lots of other options. But this is merely for educational purposes. And it is a hot topic, and it's very important that everyone understands. So if you have any question, ask me. I tend to start going, and I'll go through each slide unless you raise your hand or speak up. Some of the things you probably already know, some of the things you may not know. So definitely ask questions. So I have been an agent for over 13 years. I say I've been an agent my whole life. My dad was sold insurance. My brother's been in insurance for 50 years. So we've all been in the insurance business for a very long time. But as far as Medicare, I've been doing that for 13 years. And I work with a multitude of companies. I have licenses in 17 states. And I can't tell you how many companies I'm appointed with, but these are the main ones that work with Medicare primarily. So when you talk about Medicare, we're talking about Medicare beneficiaries. That means they've paid into the system, the FICA taxes that they pay all their lives, and they have earned the right to be on Medicare, and they become a beneficiary of the Medicare market. They have premiums they have to pay. People tell me all the time they think Medicare's free. It is not free. Not to you, not to anyone. So we'll talk about that. There are deductibles for parts A and B. And after you pay your deductibles, then you have co-insurance, which means Medicare pays 80%. You pay 20% with exceptions. And every once in a while, you may have a copayment. Not a whole lot of them, but you do have some copayments. So people who are 65 and over in this country are eligible for Medicare by age. As long as they've paid into the system, they are eligible by age. If they are under 65, you may run into quite a few people who are eligible for Medicare because of their health or disability. So these people have slightly different rules than people who are over 65 in the state of Alabama, but we can talk about that in a minute. But it used to be that people who had end-stage renal disease, they were eligible for Medicare and a drug plan and could not get Advantage plans. That has changed in the last couple of years. So now they have full protection under the law, and they can be approved within 4 months of getting being diagnosed. Other people who are approved quickly are those who may have ALS or some other extremely debilitating disease. However, beyond that, if they are deemed disabled, generally speaking, they will wait 2 years on disability before they'll be eligible for Medicare. So that's just the basic rules. So Medicare has 4 parts that we talk about that is governed by Centers for Medicare and Medicaid Services. So Part A and B are what you're going to see on a card. That's called Original Medicare. Part A is for hospitals. So what we say is if you go in the hospital, you're going to be covered for your bed. That's under Part A. Then you have, if you're there for 3 days, they may send you off to a skilled nursing facility. Under Original Medicare, it must be a 3-day stay, and you must be transported by an ambulance to the skilled nursing facility. You have 100 days coverage there. We'll get into that again later. But if you're sent home, the doctor may prescribe home health. A lot of people get confused and think home health just means they can send somebody up to help take care of people, but that's not so. It has to be after a skilled nursing or hospital stay, and it has to be prescribed by a physician. If they're deemed so ill that they're going to be expected to only live for the next 6 months, they may be prescribed hospice, which always falls back to Original Medicare. So, but no matter what plan you have, that always is covered by original Medicare again. Now, while you're in the hospital, obviously you're going to see doctors and you're going to have testing and you may have surgery and you may have tests run. All that falls under B. So Part B pays your doctors. They also cover your preventive checkups, any diagnostic tests you have, and DME stands for durable medical equipment. So if you need a cane or a breathing machine, or maybe you just need supplies for your diabetic pump, all that falls under Part B. Everything there. And that's it. That's what Medicare covers. Now, the government, because that part right there has no max out of pocket. There's no protection against the cost of original Medicare. If you get sick, you can keep going up and up and up and up. So this is a hot topic for a lot of people. The government asked insurance companies to come up with Part C or Medicare Advantage plans so that people had some type of protection against the high cost of Medicare. So Part C, again, individual insurance companies offer health insurance plans to people who are eligible for Medicare, and they give them a max out of pocket. Sometimes they'll cover their prescriptions, and sometimes they'll add dental, vision, and hearing and other things that Medicare itself doesn't cover. Outside of that, if you want to stay on original Medicare, you can get your prescription drugs also through an insurance company because that's not covered by Medicare. And we call that Part D, or prescription drug plans, or just PDPs for short. So there's two different ways to get prescription drugs, either through Part C or Part D. And we also have a Part E that's not typically listed, and that's for ancillary products such as dental, vision, hearing, or Medicare supplements, which we'll talk about again in a minute. But again, Part A and B are original Medicare. So Part A, it's kind of scary, but Part A, you had to work 40 quarters or 10 years to pay for your Medicare benefits. If you did not pay for those benefits through your taxes, or you were not married to a spouse who paid those on your behalf, then Part A costs $505 starting in January of 2024. Currently, it's $500 flat, or $499, but it's going up. Under that, if you go into the hospital on original Medicare, you have 150 lifetime days. That's it. So some of you know people who've been in and out of the hospital quite a bit. One day in the hospital is $1,632, and that covers you for 60 days. If you go home 30 days later, that's all you have paid for your bed. But if you can't stay out for that full 60-day period and you go back in, those days start adding up, and they count those as part of your lifetime days. And on day 61, they start charging $408. Again, this is 2024 numbers. And on day 91, it's $816 per day up to day 150. On day 151, you're out of coverage with Medicare. Now, this doesn't happen a lot, but it does happen. I've seen this happen. We never want that to happen to anyone, but it does. And all of you probably know someone it has happened to. So that's why we have to get some type of protection. Now, if you are sent to the skilled nursing, as you know, Medicare covers 100 days in the skilled nursing facility. The first 100 days are covered at 100%. I mean, the first 20. So sorry. The first 20 days are covered at 100%. So there's a zero copay. However, on day 21, that cost is going up to $204 per day. So for 80 days, you can pay $204 per day. On day 101, Medicare no longer covers, and that's considered long-term care. Well before that happens, usually I tell people the social workers will be assigned to you to help come up with some ways to cover that cost. And that usually ends up going either they're in a spend down program, spending down their assets, or Medicaid's going to come in and start picking up some of the cost. Again, that always goes to a social worker. And thank goodness they're there. Now, Part B, again, remember, B is for doctors or medical, anything that's medically necessary. It has a cost of $174.70 per month, starting in January of 2024. is currently $164.90. So it's going up just under $10. But there is going to be a 3.2% increase, so people should see a little bit of a gain this coming year. It does cover all
I'm sorry, Karen. We have
Yes.
a question, and I have sort of the same question. And she says, or I'm not sure who the questioner is, but so if you've worked, let's see, so if you
40
work for 2
quarters.
years, that means you automatically qualify for Medicare A and B. I'm sorry if this question does not make sense. And oh, by the
No,
way, Mr.
you do.
Thank you for recognizing social workers.
Yes, they are awesome. I used to work with a lot of social workers and they are fantastic. I couldn't do what they do, but you are automatically eligible at age 65 for Medicare.
So the copay or the $505 is only if you don't qualify through your work history or your spouse's work history.
Correct. Correct.
Okay.
So, for example, I have a lot of people who bring their aging parents over from a foreign country. They've never worked. They don't have any work history whatsoever. So they have to pay the 505 for Part A on top of the 174.70 for Part B. So most people work and have that history. So maybe the husband worked back in the good old days, the husband worked and the stay-home mom didn't. She could still qualify through her spousal taxation. So the taxes that you pay over that time pays for that Part A. We like to say that there weren't enough taxes paid. You and I know both know that's probably not true, but they said there's not enough to cover B. So that's why you have to pay a premium for Part B. So again, getting back to this, Part B covers medically necessary services. So we joke, and I try to go through everyone who's turning 65. So you can't have a facelift and a tummy tuck on Medicare because it's not medically necessary. There are exceptions to every rule, though. So my father, bless him, had an eye lift because his hooded eyes, which I have, they eventually blocked his peripheral vision. So that made it a medical necessity to have that facelift done. So he got it done, and it lasted for about 20 years before it came back. But again, he had it approved, and it was paid for by his Medicare. So there are always exceptions, but again, they always look at medically necessary services. It also covers prevention. That's a huge part of Medicare today. And whenever you look at plans, whether it's a drug plan or a Medicare Advantage plan, they're rated by stars. They get up to 5 stars. And the way they approach the prevention of disease or keeping people well goes toward that star rating. So they really focus heavily on that. And some companies will drive people nuts trying to make sure they get that wellness exam done every year. Out-of-pocket cost, if you don't have an Advantage plan, the annual deductible for Part B is going up to $240. Currently this year, it's $226. So that means the first time you see a doctor, or the first time you have a test run, or maybe you just go get your part of your yearly physical done, you will pay the first $240. After that, the coinsurance is the Medicare pays 80%, and you as the individual pay 20%, with some exceptions. There's some doctors, such as anesthesiologists, radiologists, they're allowed to charge a 15% excess charge over the 20%. So if you get a bill and it seems extremely high, that's usually because they are allowed to charge you those excess fees. And it usually happens mostly when you're in the hospital. Now, Medicare has a lot of things they don't cover.
I'm sorry, I have a question.
Okay.
Why is that? Why would anesthesiologists have the option to charge more? Is it to pay for their insurance, maybe?
It could be for that. They've never really, as far as I know, explained why. I just know there are 5 different types of doctors, 2 of which are radiologists and anesthesiologists. They're specialists, and they are any specialist, any doctor can charge that 20%, but there's some that are just deemed to be so special that they can charge you a little bit more. And again, it usually happens in the hospital, not necessarily going to your orthopedic doctor or your primary doctor. Those don't usually charge those.
Okay. Okay.
So it's just certain specialists. Don't know why. That's just something the government allows. And I'm sure at one point in time it could have been they requested that the government give them exceptions due to the high cost of operating, the high
Uh-huh.
cost of insurance, whatever it may be.
Yeah, that makes sense. Stephen Collier is asking, why are some states exempt from this charge?
Some states don't necessarily follow the same national guidelines. So we always have Massachusetts, Minnesota, and Wisconsin. They have a lot of their own rules and they don't follow the rules that everybody else does. Their Medicare supplement rules are totally different. So if you want to work in those states, you have to be really cautious about how you approach people with Medicare. So the rest of the states are typically they all fall under the federal guidelines and they do things in a very similar way. They all have their own rules. States can make their own rules up that kind of take precedent over the federal rule. So, for instance, a lot of people in other states can get a Medicare supplement when they're under 65 if they're eligible for Medicare, but not in Alabama. In Alabama, the only thing you can get is a Medicare Advantage plan until you turn 65. So each state has their own rules about how these things play out. Does that help? Crazy, I know. Okay, so Medicare, back to A and B. A and B doesn't cover acupuncture. They do not cover chiropractic services. Long-term care, that doesn't mean the first 100 days. That means any day over 100 days in a nursing facility. They don't cover dental, hearing, or vision. Now, there's an exception with vision. This is for eye exams and glasses. If you have cataracts or some disease of the eye, that is covered under Medicare, but just not the eye exam to get your glasses. Coverage outside the United States is usually not covered, even if it's an emergency.
I'm sorry, Karen. I think we have a complaint and I want to read it just because I want to honor the person who says it, which
Mhm.
is, I work in healthcare and can absolutely say with certainty that those who fall for Medicare Advantage plans always get the short end of the stick because these Part C plans do not pay for hardly anything. They don't pay for a lot of hospital stays, and most nursing homes don't contract with them because they don't pay for rehab. I'm going to skip out on the CEU for today because I thought this was more about becoming educated and less about the promotion of Advantage plans. As a social worker, I can't even
And
ethically promote Advantage plans. I encourage everyone to reach out to someone in healthcare about this and take it from those who bill insurance. Thanks for your time. I'm sorry to have disappointed Ms. Melton if she's still with us. And I
and that
think,
is perfectly fine. Mhm.
yeah, and I do
That
think
is
it's a
perfectly
fair
fine
point,
because
Karen. I
mhm,
mean, I knew when we did this that
mhm,
it would be pushback. I mentioned that to you on the phone or
you
on
did.
prior to this.
Mhm.
And so I'm glad it really, in a way, the question came up because I'd love to hear your answer. Not to say that
And I
we'll
agree.
agree with you, but I think you have a point and a position that's worth hearing.
Well, and I always say there are people out there who are adamant that Advantage plans are evil, and then there's people out there who are adamant that they are wonderful. I don't really care. We try to do what our client wants and what's best for our client. I will tell you that you are better off with an Advantage plan than on original Medicare. Now, and here's the reason. My father, that I mentioned earlier, he was great. He had Advantage for 20 years because back then that was new and he was all excited about it. Um, he developed cancer. His Medicare allowed expenses on original Medicare were $500,000 for 1 year. 1 year. He couldn't have paid that. His max out of pocket on the Advantage plan was 6,000. That he could do, but the 500,000, he would have never paid it off. He would have been, I mean, we would be paying for that bill to this day. So at least he was protected. So I'm going to say Advantage plan is not for everybody, but at least it offers the patient protection against the high cost of care. Now,
I
you're
think
right. It
that's
is not
your
a deal.
point, isn't it? Is your point you made to me about it. And Ms.
Mhm.
Palicki, Palki, I'm so sorry, Wendy. I really can't pronounce your name right, which is my fault. Not true to your statement, Karen, that it's better than original Medicare. And she says it totally depends, but I think that's the important thing to both of you, Wendy, and to you, Karen, is it depends. Dina Williams says, I work in healthcare as well. But if you cannot afford a supplement policy, Medicare Advantage can provide more than just Medicare alone. Many people see Medicare Advantage as a bad thing. It can be complicated, but when a Medicare supplement costs $250 to $350 a
Yeah,
month, and a person cannot afford it, and their income is not low enough to qualify for Medicaid for secondary help, a Medicare Advantage plan can help and usually has no premiums involved. And she continued, Advantage plans can cover rehab days and SNF as
I
well,
do.
but it can be difficult to get it approved, but it can be done. Ms. Palkey
Yes.
says many SNFs don't take Medicare Advantage plans, which I think is also, I know that to be true. Ms. Mink, Janelle Mink says, I have worked in a SNF as a discharge planner and was not a fan at all of Advantage plans. Working in home health, I've had patients that the Advantage plans have been beneficial as far as resources they provide. That is so interesting, Ms. Mink. Thank you for sharing
Yes.
that. Ms. Palkey said, and hospitals don't get paid, she said often.
Well, and there has been a move with many hospitals around the country to push people who have original Medicare to Advantage. And I mean, and the reason being is they know the insurance company is going to pay them. Number one. Number two, not everyone can, if they can't afford a supplement, maybe they wait too long and they can't get one issued. So the thing about the supplemental is number one, they can be expensive. Number two, if you can afford it, but you wait until you're outside of your initial enrollment period, you may not be healthy enough to qualify because those you have to qualify for. So I think personally, supplements are the easiest to use, and anyone who wants one, I'm thrilled to put them on them. And I have bullied families into paying for them for my clients because I knew their health care was going to require them to leave the state, and Advantage wouldn't necessarily let them do that. So I love the supplemental plans, but I also know that there's a huge place for Advantage plans for many people, and it's better than the alternative of only having original Medicare. It's
Yeah,
also
I
hard to
think
balance.
that's your thing, your point, isn't it? It's better than
Yes,
only having original Medicare. Miss
correct.
Alexander, I'm not sure if she's asking you or me, but here's a question. I have a Blue Cross Blue Shield for my supplement and I receive Medicare. I pay for my drug program separately. Is
Correct.
Medicare Advantage an option for me? And before you answer,
I tell people, go ahead.
I was going to say Miss Palkey had added in, and I listened to this actually. NPR did a segment on Medicare Advantage plans last week. Maybe worth checking out. I heard that, and one of the administrators they spoke with had said that he had had, I think, 27 different Advantage plans try and come into his rural hospital, and he had somehow been able to deny all of them access. I don't know how. But I guess he was in an area where those payers necessarily didn't have a lot of patients, maybe. But the
Um,
point was that the rural hospitals seem to be being squeezed by the Advantage plans, and I don't know if that's true or not.
I don't know. I don't work for an Advantage plan. I am an individual broker, so I'm not pushing anybody one way or the other. I literally sit down and we go through the people's needs to see which one's going to fit better. And you ask, should you check out an Advantage plan? If you have a parts, what is it's called C plus with Blue and a drug
Right.
plan, no, not necessarily. I tell people our motto is don't mess with a Medicare supplement. If you want to review your drug plan, we'll look at it, but we don't mess with med subs until somebody gets to where they absolutely can't afford them any longer. Then we
Gotcha.
can look at a supplement, I mean, an Advantage plan to replace it. But Medicare supplements, I don't mess with them. If you get one, keep it as long as you absolutely can.
So, Ms. Palkey, I just want you to hear this from her. She said, I'm happy to hear from the speaker. I just wanted to ensure people know there are pros and cons to all. And I think we're doing a
Absolutely.
pretty good job of that right now, both of us, Karen, and everyone that's
Yeah, there
contributing.
are. Absolutely. There are absolutely pros and cons. So I'm going to go and get back to this because I want people to know, even though you get a Medicare supplement, if Medicare doesn't cover it, your supplement won't cover it. So hearing aids, vision, dental, none of that is covered under Medicare. So it's not covered by your Medicare supplement. And you have to add prescription drug plans because Medicare doesn't cover it. That's the main thing to know. Now, Medicare prescription drugs are the worst part about Medicare. So there are late enrollment penalties for A, B, and Part D if you don't pick one up when you first are eligible, whether that's on disability or when you turn 65. So say you want to work as long as possible and you want to keep your group insurance, so you only sign up for A. When you go to sign up for B, you have to prove you've had that group insurance, or Social Security will charge you a 10% penalty for Part B for the rest of your life and a 1% per month penalty for Part D for the rest of your life. Again, I tell people, if you got group insurance, keep it as long as you can. Do not pay for Part B. Let me know and I'll help you sign up for Part B when it's time. Give yourself at least 3 months. That's a whole different thing. But the main reason for keeping a group plan when you're over 65 is because prescriptions under Part D are a nightmare. Just flat out. It's expensive and you have limited coverage under Medicare. So Social Security designs the structure, not the insurance companies. And all insurance plans for prescription drugs have to meet a minimum standard set forth by Social Security. They can charge you more for better coverage, but they all have to be at least as good as Medicare. And they all, as Social Security says, and they all have to cover 2 drugs in every class. So they may not cover the brand. So for example, there's some great drugs out there for blood pressure now, Eliquis and Xarelto. They're very similar, but one's made by one manufacturer, the other's made by another. If you pick up a drug plan, one plan may cover Eliquis, but not Xarelto, and vice versa. So you pick a plan that works with the particular drugs that you take. So you only need A or B to get a prescription drug plan, and they have to be available in your county. So all plans are sold by county, whether it's Advantage or prescription drugs. You can only have one at a time. So if you have an Advantage plan, you usually have to get prescription coverage in the Advantage plan, with exceptions, or you pick up a supplement, you get a separate drug plan. They have deductibles. Unless you buy up, you're going to have a deductible. And then you go into the initial coverage period where you have copays for your drugs. Once you get through that, there's a coverage gap called the donut hole that a lot of people complain about. And that's why I say, if you can keep group insurance as long as possible, do it. But if you go on to Medicare, you got to know about the donut hole, and it affects every plan there is on the market, no matter which one you go with. And then the catastrophic stage, and I hope nobody gets into it, but I do have people. I've got a lady right now who will go through all 4 stages in 1 month because the cost of her prescriptions are so high. So the deductible for 2024 is going to be $545. Most plans don't charge that for tier 1 and 2 drugs, but some do. But the most of them, they'll let you just pay the copay for tier 1 and 2 and bypass that deductible. However, any tier 3 drug where it's generic or name brand will pay the first $545. After that, you have an allowance of $5,030 for next year. So what that means is, no matter how you're getting your prescription coverage, if you pay and the insurance company pays $530, you've used up your allowance for the whole year. And you're out. Then you're in the coverage gap. And so you say nobody's going to spend that much money. That Eliquis we talked about used to be $1,000 a month. It's come down. As it gets older, it gets cheaper. But at $1,000 a month, that's 5 months worth of coverage. And then you're in the gap. And you're going to pay 25% for that drug after that. The brand has to pay 70%, The insurance company pays 5. The main thing is 25% of $1,000 is $250 a month. That adds up fast. The generics, you just pay 25%. After you spend $8,000 for next year, then you're going to be in the catastrophic phase where you'll pay 5%. That's easier to pay. However, it hurts getting through this coverage gap phase. There's help out there. So you mentioned earlier people who went on Medicaid. There are programs called Extra Help from Social Security. We call them low income subsidies. And we always check people's income to see if they might be eligible for that. That can keep their costs down. It also negates penalties for Part D. Or if they're eligible for Medicaid to pay that Part B premium, then they would also be eligible for extra help that keeps that cost down. So people who are in those categories start off in the catastrophic phase.
So this
People
is
who
the hole that I've heard about all of my life. You're
Yes.
explaining that. Okay. And we've got,
Yes.
I've fallen down on my reading of comments. Ms. Smith asked if we get handouts. Yes, we will. With your permission, Karen, we'll share this. And Ms. Polk says, can you speak briefly about the legislation that is looking to change those levels of cost associated with Part D? I was under the impression catastrophic and eventually the donut hole may go away, but I hate watching the news. So do I, Ms. Polk. So I could be misinformed.
No, you are correct. There is legislation out there. They're trying to, by the year 25, put an end to this part. Now, they're still going to have the deductible and the co-insurance phase. However, they're trying to stop it at the coverage gap so that if you hit that, then you no longer have to pay. It's still up in the air as to whether they're going to let it take effect. But as of the 25, we're hoping they put an end to it. That still means that they're going to allow you to spend up to, right now, they said a little over $2,800 out of pocket before that happens.
Annually.
Correct, on prescriptions.
And Ms. Nix just points out Eliquis is currently in the top 10 of
It's great.
Medicare Part D's costliest drugs. And I think it is one pretty sure that's being negotiated. Is that correct?
It hasn't, they have come out with a generic. And as of last year, the government gave them an extension on the patent. So the generic can't be released until possibly 25, if they allow it then. But the cost is coming down. It is one of the most expensive, but it's a very effective drug. So for people who don't want to have to go have their blood drawn every month, it's been proven very effective, and it's keeping people stable and doesn't damage their organs the way the warfarins and the other drugs it's replacing do. So yes, it's expensive, but
Ms.
I'm not a
Smith,
doctor.
Tiffany Smith says, from my experiences, the Medicare Advantage plans are more beneficial to individuals who are healthy enough to stay out of the hospital. The approval processes for SNF rehab is very difficult. Chronically ill individuals are definitely at a disadvantage, pointing to the need for planning for our increasing elderly population. Hear, hear, Ms. Smith. Thank you for preaching. And Ms. Polk says anything that involves the government is always up in the air, but thank you for your comments.
It is always up in the air. And I can't tell you definitively that they are absolutely going to do something, because they change with whomever is in power. And we all know that. And sometimes it's for the better and sometimes it's for the worse. For right now, I can tell you the way it works currently, and hope and pray that we all have good support in office that can get us what we need for the future, because we're all eventually going to be on Medicare. And we all have to deal with this. This is what we're looking forward to. And if people in power have the right to a one-payer system, they're going to build it on Medicare. So it needs to get better. I'm not saying that this is a great system. I'm telling you, this is the worst part of Medicare, is the drug coverage. And I'm praying it does get better, because I'll be on it soon, and I have to deal with the same thing everybody else does. So anyway, yeah, drug coverage stinks, especially if you take an expensive drug. And I have a lot of clients that this really hurts. That's why I said, if you can continue to work and keep your group insurance and you take expensive drugs, you'll benefit from that for the longest period of time. But eventually everybody goes to this. because we all have to retire sometime. Now, the options are Medicare supplements or Advantage. And again, I show this to everyone. Medicare supplements, there are plans A through N. They took F and C off the market in 2020. So if you turned 65 before January 1, 2020, you could still purchase a plan F, even if you're working today. However, and the rest of us have to go to G if we want the best. So I'll point out the X's mean it's not covered. So all these costs under Medicare are covered by G except for the Part B deductible. And that again for next year is $240. The government feels like we have to pay something. We have to pay our first dollar for our health cost. That's why they pulled it up, the F and C off the market. They felt like you need to pay first dollar for your health insurance needs. And this is 240 is relatively little. It's not a lot. But again, some people feel like that's just too much to pay for, and they do go to Advantage. I have a lot of people who are wealthy and they don't want to pay this cost. And I have a lot of people who are poor and they don't want to end up in a network. So it's an individual choice. I don't make it for people. I present both sides, let them choose. And I'm not supposed to say what I would do. Personally, this is where I'm going though, for you guys. I want to supplement because I travel, I have health issues, and this way I know I'll have the most comprehensive coverage under Medicare. I will have
Karen, I think you've frozen up. Has everyone frozen up or just Karen? But I think it's important what she was saying. And I'm so sorry Miss Melton left, but while she's talking about Medicare, original Medicare, Medicare Advantage, she also, I thank you, Miss Talbot. I can't hear her either. It's like she went away. And I may have to finish the hour for her. What time is it? 42 minutes after we've hit our mark, y'all. I can hear you, Sean, but not Karen. Karen Morse, here comes her screen. Let's see if she comes back in.
I am back.
Oh, thank you.
Thank you.
Thank you.
Yeah, I think we
Lost
just
you.
lost Zoom. Okay. Well, I don't know if you heard the last slide about the supplement.
The last thing I heard you say, which I thought was very important, Karen, and I'm so sorry Miss Melton didn't stick around to hear this, but you said for you, well, you're not supposed to say this. We're not in a sales situation. We're just getting information. And you said for you, you'll go the supplement route.
Correct.
Not the Advantage route.
Correct. Because for me, again, for those who didn't hear, I travel, I have health needs, and I want to make sure that I have the most comprehensive coverage. And so I know I will supplement my Medicare supplement with a drug plan and dental, vision, and hearing. But again, if you want to be able to go to any doctor you want to see without having to worry if they are in the network, you're going to go with a supplement. Because hands down, the only network is Medicare. Not every doctor, FYI, takes Medicare. So you do have to check your doctors before you go back once you turn 65. But there are a lot of doctors do take it. So not every hospital takes Medicare, believe it or not. So beyond that, that's the route that I would take. And that's the one I suggest to people who, if they're coming in and they tell me they have cancer, absolutely, they're going to go with the Medicare supplement. But you have to go through underwriting once you are 65 and a half. So over 65 and a half, they're going to ask health questions. And if you can't pass underwriting, they may rate you up. That means I just had a lady who's 66 and she couldn't pass the underwriting. Her her Medicare supplement is $350 a month. For her, it's worth it. So she's going that route and she's going to pay for her Part D. But again, it's underwritten. I have other people who can't pass the underwriting at all and they get declined. So their backup option is Medicare Advantage. Again, yes, it's problematic. You have to get approval from insurance companies. And we try to suggest PPOs because that way, if the facility of choice is not covered, at least you still have an option to go. You may pay a little bit more, but at least you can use those facilities. Now, again, it's an option, and whichever way you lean, if you like Advantage or you like supplement, it's a personal choice for a lot of people. So Medicare supplements have to cover A and B, but they do it in a different way. So instead of that deductible for Part A, they may pay a copay for their hospitalization, which is around $300 a day, up to 6, 7, sometimes 9 days now. It's getting ridiculous. And they cover prescription drugs, most of them, not all of them, but most of them. And they may build in dental, vision, hearing, chiropractic, acupuncture, all these different things that Medicare doesn't cover may be offered under Part C or Advantage plans. To get a Part C, though, you have to have A and B, and you can only get one that's available in your county. So then this is the option. This is what we share with our clients. You have options. Which one's best for you? It's not my choice. This is a personal choice for people. I can just tell them that if you go with the Advantage, the cost to you is a network. You have to go with the network that belongs to the carrier you choose, and they're responsible for taking care of your needs going forward. So you have to get approval from them to go see any provider. You have to go, if you need to go to skilled nursing, it needs to be in the network unless you have a PPO. So yes, there's a cost to people. Even though it's zero premium, there is a cost to Advantage. And we do try to explain that to people. Again, it's some people's first choice. Others like me, the supplement's going to be the first choice. And I don't care which way you go, as long as you pick the one that's best for you and you know what the limits are. So that's Medicare 101 for what it's worth. The downside.
Go
Go ahead.
I was going to say, I should tell people the reason you're here and the reason I trusted you to do this topic, which I knew would be kind of a lightning rod, is really
Controversial. Yeah.
two reasons. One is you've been my agent twice, 10 or more years ago, and one of my children was having a health concern, and we needed to look at our options, and you ultimately talked yourself out of a commission. And again, about 3 months ago, as my wife and I were looking at options, you again talked yourself out of a commission because you do the right thing. And, I think that's one of the things I wanted also to see happen here was not to vilify, the Medicare Advantage folks, people that sell those plans, because there are reasons for certain people that they make sense. And we've already had some of our attendees talk about those, but I knew you would give both sides, and I kind of knew you'd fall on the supplement side just because you're smart.
Yeah.
Anyway, I would encourage others to ask any more questions you may have, because I know one of the things you said you might hope, and we've got about 12 minutes to get onto, is the Obamacare market, or however that's known. You said you might have some side if people have questions about that, which is open enrollment is right about now, isn't it?
November 1st to December 15th for a January 1 start date. And there is an extension to January the 15th if you miss out on that. But that's been going on for years now. And ACA, love it or hate it, at least people can get health care. And I'm one of those people because, again, I had health issues. And back in the day, I couldn't get health insurance after my divorce because I have a bad back. It's not like I'm deathly ill, but I have a bad back and no one would cover me. I was able to get help through pre-existing conditions insurance plan, but now that's gone. Now we have ACA. ACA is horrible and wonderful at the same time. So if you're poor, it's a great plan because you can get health insurance for cheap. But if you have money, it's ridiculously expensive, and the cost of healthcare has been driven up astronomically as a result. So I hate that side of it. And no matter how you feel about it, at least people can get some health insurance, is all I'll say. But ACA, you have to be careful what you buy because we have HMOs and PPOs and Some of the PPOs are mislabeled because you buy them and it says PPO, and you found out you have to have a primary care provider, and you can't even go to an urgent care unless you have gotten approval first. So be careful. Talk to somebody you trust. Don't just call the marketplace, because they're going to sign you up for whatever's the cheapest. They're going to give you the options, and they're not going to explain to you why it may not work.
We've got a question. Ms. Nix says, for enrollment, can a patient enroll or change a Medicare Advantage plan anytime if the plan is 5-star rated?
They have one opportunity per year from January to November to change into a 5-star plan, one time. So if they get in it and they don't like it, they can't change back. Open enrollment is October the 15th to December the 7th every year for Advantage plans. So that's going on right now. After that, we have OEP, which we're not supposed to advertise, which means if they didn't get to Medicare Advantage open enrollment season or annual enrollment season, they wish they'd switch from January 1st to March 31st, they can switch one time. They can either drop that Advantage plan and go back to a Medicare supplement and a drug plan, or they can go to another Medicare Advantage plan. Can't change drug plans at all except during open enrollment. After that, if you have LIS, that low income subsidy or extra help from Social Security, or you have you're a member of the Medicare Savings Program, or Medicaid's paying your Part B, or you have Medicaid assistance, you can change one time the first quarter, one time the second quarter, and one time the third quarter. Other than that, everybody has to adhere to the annual enrollment period rules.
With if you switch back from Advantage to Medicare, is there a penalty, like a drug plan penalty?
No, thank you, President. The penalties are only incurred for late enrollment. So
Okay.
for those people out there who say, I don't take any drugs, why should I get a drug plan? And that happens. First of all, you don't know what's going to happen in the next 12 months. And you may need that drug coverage. You cannot apply for it until next open enrollment, and it wouldn't start till the following January. So that's the first problem. The second is, when you do apply for it and you get approved, you're going to have a penalty for that whole year you didn't have coverage. That's the penalty we're talking about. And that will go with you for the rest of your life, unless you are eligible for the programs through the federal government, like LIS.
You know, back to the ACA, when we looked at that, we were actually cheaper not going to the ACA.
You can be, yes. Now, again, the ACA is cheaper for people with lower income.
Well, you know, here's the thing. I had an employee that showed a lower income, and it also was cheaper to do that with the employee versus going to the ACA.
Yeah, there's a tipping point where you might think 50,000 is is higher income. According to the government, I mean, if you're below 50, sometimes you're cheaper. I had somebody call me this morning. They told me they're going through enrollment for their group plan right now. So I said, I can't send out next year's numbers until November 1st, but I will send you what is available now based on your income and your household side, and it will help you decide which way to go. So for some people, it's cheaper. For others, it's not. And it just depends on the carrier. If your company is paying 100% of your premium, or even 75% of your premium, you need to keep it. There's no way you're going to beat that. But other people, the marketplace is cheaper. And again, we don't charge for our services. We're not allowed. I'm glad to send out quotes. That doesn't mean that I'm going to call you and bombard you with what, and hound you until you sign up. I'm going to tell you if it's cheaper. Yeah.
I can attest to that. Right. You're very low pressure, low key, which again is why you're here.
Well, thank you. Yeah, we try to do what's right, because then eventually you'll send me other people, because you know that I'll take care of them in the best way. That's the hope.
I live the same life. I just want to do the right thing by you and trust that God has a plan, and that if it's in that plan that you would bring me future business because I was good to you, then great. If it's not in that plan, I did the right thing, and that's all I can. So
Exactly. And be careful because there's a lot of me's out there. There's a ton of people out there who are out there to do the right thing. There's also a ton of people who are out there just to make a sale. So be careful who you choose to help you. Um, Not everybody cares. Some people just want to make a buck.
Yes, it's true in every business, isn't it?
Yeah, it makes us look bad. It really does.
I know. I have what I do has a bad reputation. And I live with that. This is why I try and have a personally a good one. But anyway, thank you so much. We don't have any other questions about the ACA, and I appreciate you being candid and flexible and throwing or catching the curveball that we threw you here. And I would love to hear maybe Ms. Smith asked, what is the ACA?
That's a good point. ACA stands for Affordable Care Act. Some people just call it the marketplace, health insurance marketplace. It is health insurance that is guaranteed issue through the government, and you have to apply through the health insurance marketplace to buy it. You can get help paying for it through subsidies based on the taxes that you're paying in, or you can pay flat out for it. So if you have a client who's not healthy and they can't get an individual plan, they can go through the marketplace because there's no underwriting. And everybody thinks all plans are not underwritten anymore, but they are. Some plans are underwritten. It's just the ACA plans are not.
But again, if
And
you're doing an ACA, you want to make sure you have not an HMO, but a
a
preferred
PPO.
PPO.
A PPO.
Because
Because unless, and some people think that they're really great at referrals, but unless you're great at managing referrals, and I preach this and I preach it and I preach it to my clients who choose one of these plans, and inevitably I'm going to get a call saying it's a Sunday afternoon and I can't get into the emergency because there's too many people and the urgent care just turned me away because they forgot to get that referral from their primary care provider. So I usually won't even show people those plans because I know how hard they are to use, and I want you to have a plan that you can use no matter what happens to you.
Well, I know that to be true because you steered me away from those because they were cheaper.
They are
They look
cheaper.
the
That
same. They
doesn't mean
look the
that they're
same
good.
on paper. How do you know that?
Right. And you need, and it's like with you, I send out quotes and I tell people to read the summary of benefits because it will tell you if you have to have referrals or not.
Right. Right. Well, it's 57 after. I'll give the password now, and let me just type in very quickly into the chat room. Again, our password protected evaluation link, which today the link for our survey is https:// www.surveymonkey.com/r/ these are all uppercase letters, KWYYQXX. That is the evaluation link. The evaluation password is lowercase I independent. And I chose this because Karen is an independent agent who, like me, will give you information and education and wink when she thinks you ought to do something, but in the end is there to be your advocate, your guide, your counsel, and your independent agent who will help you make the best decision for you, not the best decision for Karen. So today's password with a lowercase I is independent. And we appreciate Karen, Ms. Morse. I should have been calling you Ms. Morse this whole time, but I feel like I know you too well.
No,
Thank
I
her.
prefer
Thank
Karen.
you
Thank
for
you.
being here so much. Thank you for weathering what I thought was a very robust and good discussion. And I appreciate your time and doing this for me for free. It was very much appreciated.
You are welcome. Thank you so much for having me, and I wish y'all all the best. Call me if you need me.
We
Thank
will.
you.
And I'll send this presentation out with your contact on it.
Thank
Thank
you. Y'all have a
everybody.
great one.
Please do your evaluation by 8 o'clock tonight. I'll get the evaluations out, send this presentation with them. Nurses will be posting your hours for you onto the ABN website. Social workers and nurses, everyone who does an evaluation gets a certificate for 1.0 hour. Thank you so much. I hope to see you next Monday. We'll have an ethics presentation on the ethics of mandatory reporting. Thank you so much. Y'all have a great week.